Home health differs from other areas of healthcare in that the healthcare providers, they provide the care the client needs in their environment. Home health care is provided in the client's environment. That's their home. We do provide that individualized care. There's different types of reimbursements. There's an additional charting that is required, but we provide that same care in the client's home. Before we go out and take care of our patients, we want to check with our own feelings. How do we feel about taking care of any particular set or population of patients? Do we want to work in the urgent care? Do we want to work in the long-term care facility, and etc.? But we must also establish that rapport, that therapeutic relationship, that trust with the patients and their family. And it's like a partnership. It is a partnership. Now, that partnership may take a little bit longer because you're coming into the people's homes. So unlike where you're at the hospital, it's just like an unspoken code. Yeah, people are going to come in all the time, but I don't know. That's different than being in that hospital or acute care setting than being in someone's home. So it is really important that you establish that trust of that families, that patients, and that you work in a partnership to be most effective when you're providing that care in the home. We do want our patients, because home health care is intermittent, unlike being in a hospital, someone's there 24/7. When care is being provided in the home, for example, the nurse may come on Monday, Wednesdays, and Fridays from 11 to 11:45. CNA, the unlicensed personnel, may come on Thursdays and Tuesdays from 8 a.m. to 9 p.m. That care is intermittent, meaning it is not continuous care. And because of that, we want our clients to be as self-sufficient, as self-disciplined, and take care of themselves as much as possible. So we have to stress teaching those clients to participate in those self-care activities so that they can be as independent to the optimal level of care as possible. Let's go back to that documentation. The Omaha system is the system that's typically used. The system was developed by a visiting nurses association in Omaha, and it is based on home nursing documentation needs. The Omaha system is most relevant to home health nursing, and is most typically used by home health nurses. So we do know that the roles, the responsibilities, and functions of healthcare professionals that's providing that home care, those that Medicare regulations, those are the things that guide the responsibilities and functions of healthcare professionals in that home setting. Medicare regulations, professional organizations, and state licensing boards, they guide what we do when we go into those homes. Many of these services can be provided on a consulting basis. The nurse still provides that direct care, though, for that client, even though we have others on the team that we're collaborating with. And it is important. Each person is essential on that team. It is really important that we share information, especially when that patient's setting of care is changing. For example, if they're in the hospital, that's acute care, they're coming home. It is essential that communication between the people at the hospital and the home health agency, that they communicate, what is going on with this patient? What are the client needs? that they talk about everything and discuss everything from A to Z so that that care, that continuity of care can continue. Case management, in contrast to the definition of care management, case management involves implementing that individualized care. We may have 3 patients that all have diabetes. Patient in room 201, 202, and 203. One may be a newly diagnosed, one may be a type 1, maybe one might be a type 2. We might have one that has type 2 and they've recently had hip surgery. No matter if we have several patients that have the same chronic disease processes, we are providing that individualized care. Care management is an enduring process in which a population manager establishes systems and monitors the health status, the resources, and outcomes for that population or that group. Case management, in contrast, involves implementing that individualized care. Fragmenting services is a challenge of healthcare. And because of that fragmenting, we might see overuse, underuse, or gaps in care, and also miscommunication. Clients who have a primary care provider typically know who that provider is, and they recognize that provider should be seen first. You know, we do have those referral systems. Sometimes if it's a hardship and, you know, that primary provider has referred that patient to a specialist, sometimes those patients might not go. They may say, well, hey, let's let my healthcare provider take care of everything. So that will equal underuse. Overuse, an example of overuse is when the healthcare provider, that primary person, has been referred to underuse is where the healthcare provider may refer that patient out and they may decide not to go and see that specialist. And they may just say, you know, I just want my primary care provider to provide everything from A to Z. Overuse can happen when the primary provider has referred a patient. They've run a series of tests that are current. That patient goes to that specialist and that specialist reorders those same exams, even though these exams and tests have been completed within maybe 1 to 2 days prior. And so that leads to overuse. And then sometimes there's that gap in care where things just kind of get dropped or missed. So we do want to be thinking about that as our patients navigate through the healthcare system, because we do have the potential for overuse, underuse, and gaps in care. Case management competencies requires the following knowledge and skills: knowledge of community resources, financing methods, written and oral communication, and documentation skills, negotiation and conflict skills, critical thinking processes. All these things are needed to identify and prioritize problems from the provider and the client views, and to identify the best resources for the desired outcomes. Case management can be labor intensive, time consuming, and costly. Case management time is demanding and is usually restricted to those complex cases. Because of the increasing number of clients with complex problems in nursing in those care loads, the intensity and duration of those activities that are required to support that case management function. And then, so that's why case management is limited to those or restricted to those complex cases. But nevertheless, case management should be providing that individualized care to those patients. In collaborating, an individual attempts to work with others toward solutions that satisfy the needs of both parties. Assertiveness is the ability to present one's own needs. Cooperation is the ability to understand and meet the needs of others. When compromising, an individual attempts to find a mutually acceptable solution that partially satisfies both parties. We must have trust at all times with our communities, with our patients, especially in the time of a crisis. The assistance of community leaders at those times of crisis, when you're trying to introduce new programs and projects, especially at a time of crisis, is extremely helpful. Getting that assistance from that community leader is extremely helpful to getting that word out and to mobilize and being able to operationalize and do those things that you need to do in those communities. When we're delegating and we're trying to assign our unlicensed personnel or our nurses assistants, remember we would not assign a nursing assistant someone that is unstable, even though we might need them to do oral care. We might need them to weigh that patient. If they're deemed unstable, then we would not assign that client or that patient to that unlicensed personnel. When we're delegating care to the nursing assistant, we want to give specific instructions as to what should be done. We want to instruct how it should be done. Give those details and list what information should be reported. And then, even though we delegated, it's still our responsibility. It's the responsibility of the person that delegated to follow up on all of these things. We do know that a person that's going under rehabilitation is that tertiary level of care, and they will want to improve whatever their functional mobility is and or their independence. And that rehabilitation is that tertiary level of care. We do know at a minimum, our patients are turned in reposition every 2 hours. That's at a minimum. They're kept clean and dry, But in the event that there's some alteration in that skin, there's a potential for a pressure area, or if there's a stage 1 there, we need to do some things to promote that skin healing and to prevent further damage pretty quickly. We might have to turn that patient every hour because the standard is at a minimum every 2 already. But the patient will need to be turned more often, and we want to prevent further damage, and we want to promote that healing as quickly as possible. We want to turn that patient every hour. We do not want to put a warm compress on that area. And we many times they would put a transparent, that clear dressing on there to cover that site to ensure that the proper amount of moisture is present for wound healing while allowing us to be able to also monitor that area. We want to ensure that our clients' rooms are free of things that will make us fall, that spills are cleaned up, that our patients are wearing those non-skid shoes. If they have those area rugs in the homes, we want to ensure that they have those non-slip paddings up under those rugs, because if not, those rugs are easy to move and someone to step on it, you will even fall. So you can imagine someone that has a disease process or some type of limitation in movement in their joints and things. But we want to ensure that they have on non-slip shoes, they have that non-slip padding up under those rugs. If they would remove the rug altogether, that would be good. But if not, just ensure that they have that non-slip padding that prevents that rug from moving.